with a healer's heart, just learning how to trust my hands. I walked those halls believing medicine was built on truth and plans. But then one night I touched warm skin they'd already labeled brain dead. His chest still rose, his heart still beat, and questions flooded in my head. They said prepare the donor, but nothing felt aligned. And I whispered to myself, if he's dead, why does his body still respond to mine? That moment never left me, it rewrote everything I knew. I carried it for years until the truth finally broke through. So I wrote the brain death fallacy, because families deserve the light. And I could not stay silent while the world was told a lie, disguised as a right. I followed every thread I found, the laws, the words, the history. And I learned how brain death was constructed to make procurement legally easy. Not to honor what life truly is, not to guard a fragile soul, but to soothe the conscience of a system that needed bodies to stay whole. I saw how swelling, drugs, and injury can mimic what they call the end. Yet people breathing on their own were being taken from their families and friends. So I wrote the brain death fallacy to say what others wouldn't say. Brain death is not true death, it is a legal term they redefined one day. I wrote it for the parents, for the husbands left behind, for the mothers signing papers without anyone being kind. I've seen the children who grew afterward, the women who carry life inside, the patients who woke with memory after doctors said they'd already died. I've watched the harm the apnea test can cause, a test they never explain. I've seen drugs suppress a body till no movement can remain. And I promise God that day, if I know the truth I cannot hide, I will stand between these families and the force that takes their child. I'm not here to condemn my colleagues, most were never truly taught. They trusted what the textbook said, as I once blindly thought. But courage is a quiet thing, a whisper you cannot shake. And my conscience said, Heidi, speak, even if your voice must break. So I poured it all into the pages, every fact, each painful scene, to show what's real behind the curtain and what the definitions really mean. Yes, I wrote the brain death fallacy, so no family stands alone, so no mother loses her child because truth was never shown. If my voice can give them strength, if my witness helps one heart, then every sleepless night was worth it, and my calling did its part. I'm Heidi Klessig, a doctor, a witness, a healer with a fire, and I'll keep shining light into the darkness for every soul they call expired. Because life is sacred, precious, until true death takes its stand. And I will keep on fighting with the truth held in my hand.
All right. Welcome everyone to the sixth day or fifth day of our Crime Victim Rights Week series that we're doing. I know a lot of you have emailed me and said you were really excited about this one. Not that you weren't excited about the other ones, the other sessions, but to hear from a brain death survivor is a big deal for a lot of people, because we all in every in every series of lessons that we've done this week. So we started, just to remind people where we've been on this journey. On Sunday, we had A Nation Remembers Medical Crime Victims Vigil, where we read the names and we read the proclamation. We had a vigil for those who had fallen victim to medical crimes. We said their names. We're going to say their names again on Sunday in our closing ceremony this coming Sunday. We are also going to, going to be a little different feel, but we are going to say their names. So if you want your loved one on that list, go to our website and click Memorial Wall. It's very simple to put them in, and that will come to me and I'll get them on the list. And then Monday we talked about, with Leslie Batts, we talked about reporting medical crimes, your rights, your voice, your actions. We talked about who was who in the zoo, in the government zoo, which is very hard to figure out sometimes. We talked about whether they were really immune or not. And we gave you some templates, which are on our website under resources, digital downloads, to take that next action to report your medical crimes, whatever crimes happen to fit your case, whether it's fraud or medical battery or whatever it is, but to report it locally and most importantly, federally, to the right people. It's great to write letters to the president, but he's never going to do anything. We want to report these crimes not because we think each crime is going to be prosecuted, but because it's not your job to prove a crime. It's your job to report the crime. And by reporting it, if enough people report it, it will prove a pattern. And patterns they have to investigate. In onesies, twosies, they can just kick it back. But if enough people do it, they cannot deny that they knew about a pattern. And then on Tuesday we talked with Dr. Margaret, and Laura Bartlett about the things that happened beyond the ER door. Was it murder? A lot of times we see people that they'll talk about everything, they'll talk about the origins of COVID and all of these things. But when it gets to the ER door and beyond, they don't want to talk about it. Everybody clams up. We're talking about it. We talked about evidence-based versus incentive-based medicine. When you hear people say we had to practice evidence-based medicine, no, it was incentive-based. Evidence-based would be, if they were really doing evidence-based, it wouldn't be doing the things that kill patients. It would be doing the things that save patients. That's evidence, not the things that kill them and give them great amounts of money. We talked about the standard of care, and we did talk about brain death a little bit. Dr. Aranda put that in her Substack, some of the videos of the honor walk and things like that, and how we touched on that. And then we talked about how to be prepared with the I do not consent form.com and the great things that are on halovoice.org. And then yesterday, Marcia and Terry walked us through hospice, the history, whether people were really dying. We got an education, and there were tons of people watching in that session. I think that was our most watched, and now I can see this one climbing too. And she talked about the ham sandwich and the tactics that they use, what they say versus what they mean. Totally different thing. Well, today you're going to get a bigger education on surviving brain death and organ harvesting. Dr. Heidi Klessig has a great presentation. The song that you heard in the intro was written by Heidi Bond, who is our outreach and partnership chairperson, and she sits on our board, and her best friend Lupe was killed in the hospital. And she was so moved by Dr. Klessig's work that she wrote a song, and it really touched Dr. Klessig's heart as well. But all of those people that you saw in that video, those are real people. Those are real people. And so you're going to hear from Jenny, who is a survivor. You're going to hear about how to protect yourself, but you're going to hear about, the business of organs and the brain death fallacy. And I do want to show you very quickly, before we go into the presentation, this Dr. Heidi Klessig's website is called respectforhumanlife.com. Respectforhumanlife.com. This is a great website. It has so much information about the types of donations, organ trafficking, books, videos, but it has this survivors page. These are survivors that were diagnosed as brain dead. This should shock us. This should just simply shock us that it's more than just one person, right? And so when I saw this, this is I send this to everybody who doesn't believe. I send it to everybody. So with that, I want to go into
go up a little bit on that page, Gail.
Mm-hmm.
Go up a little bit. Because the next person there is the person right here.
Yes.
This is Jenny, and she is here as a testament to what happened.
Yep. Good call out. And of course, we all know about Anthony Hoover, who was 17. That's, real people. So that gets me emotional. That gets me actually teary, because I don't know. I cannot imagine anything quite like that, being told that you're brain dead, that you're unsalvageable, and knowing that was said about you. It's absolutely insane. I'm going to turn it over to you, Dr. Klessig, to introduce yourself, and you tell me where to go with this PowerPoint. I'm going to make it a little bigger, because otherwise Katie's going to let me know that they can't read it. So just kidding, okay. Katie.
Well, thank you so much, Gail and Mick and Marcia for having me on, and what an honor to be speaking with Jenny. I mean, we've talked on the phone, and I'm just so thrilled to be able to share a platform with her. And thank you to Heidi Bond. When I first heard that song, and every time I hear that song, I just I get choked up. I can't believe how kind she was to write such a song as that. But really, since this is Medical Crime Victims Highlight Day, I want to bring up, yes, those survivors, they live to tell the tale. But I asked Search Assist just before coming on, how many people were so-called deceased organ donors in 2025? And there were 16,550 people who had their life removed from them, and they don't have a photo, and they don't have a saga like we have for the survivors. So that's who I'm remembering today as I speak. 16,550 people falsely had their human rights removed by being declared somehow dead, while many of them still had a beating heart. They were warm, they were digesting food. I mean, these people were in no way dead. In fact, you cannot donate a viable organ from a corpse. I mean, think about it. If you took a dead corpse and took out a dead kidney and put it into a living person, it would only do harm. So my thoughts today, as it's Crime Week, is I'm thinking about those 16-some thousand people falsely declared to be dead enough to become organ donors with no type of informed consent. So Gail, if you want me, I can start with a presentation, or tell me when you want to have Jenny talk, because that's what I'm looking forward to.
I'm muted. Yeah, let's go into the your presentation, and you just tell me which slides to stop on, and like you usually do, like which slides to go through, and when we get to the through the basics, so people understand the definitions, and because I know they're thinking, well, how could a mistake be made, like saying somebody's dead when they're not, because they don't understand.
Sure. So let's talk about brain death, and then we'll have Jenny tell us what it's like firsthand personally. So I'm on slide 2, Gail. So this is personal for me too. I came in for call one night in my anesthesiology residency training, and I reported for duty at the desk, and they told me, please go up to ICU. We have a brain dead man we'd like you to bring down and anesthetize for an organ harvesting. And honestly, I was shocked. I was not prepared. I asked the doctor at the desk, wow, brain death, is there anything different I need to know? And honestly, he laughed and he rolled his eyes and he said, just be sure someone has actually declared him brain dead. You know how eager the transplant team can be. Which I didn't find one bit reassuring, but I went up to ICU. I found my patient. He looked kind of like the picture here. He had normal vital signs. I mean, vital signs. Think about that. Vital comes from the Latin vitalis, meaning of or pertaining to life. So he had life signs. He had a blood pressure that was good. He had a good heart rate. He had nearly 100% oxygen saturation in his blood. He was warm. He looked like every other ICU patient I'd cared for, and in fact, better than most. You can go to the next slide. But since he was somehow dead, I mean, the neurologist, I checked in this chart, the neurologist had checked all the boxes on the brain death protocol and declared this breathing, heart beating man to be somehow dead. So I just went along with it, sadly. I took a look at him. I listened to his heart and lungs. I went down to the operating room and found the anesthesiologist who was going to be supervising me for the case. I presented these facts to him, and he asked me, well, what kind of anesthetic are you going to give? And I said, since I was sort of brainwashed, honestly, at the time, I said, I think I'll give him a paralyzing agent so he doesn't move and upset the surgeons. And I think I'll give fentanyl as a potent painkiller that'll blunt any response to the incisions and the bone saws that might cause blood pressure or heart rate swings that might damage his organs. And so then my attending said, that sounds good. Are you going to give him anything to block consciousness? And I was very confused at that point. I was stunned. I asked him, I said, why would I do that? Isn't he dead? And my attending just gave me a long look over his surgical mask, and he said, why don't you give a drug to block conscious awareness just in case? Mm-hmm. And he walked away. That made no sense to me, but I figured I was in training, and here everyone else was going along with it. I mean, there was an operating room staff, there were surgeons, everyone was waiting for me. So, despite what my gut was telling me, to my regret and shame, I just went along with it. And so I went up and I got that patient. I brought him down to the operating room. I hooked him up to all the monitors. I gave him the anesthetic that we had proposed. And I'm here to tell you, he reacted to the incisions, the bone saws, the organ manipulation, just like anybody else. He required exactly the same types and amounts of anesthesia. And it's my regret over this experience that caused me to look further and to research this. I talked to a pathologist friend of mine recently and told her my story, and she said, Heidi, when I remove organs during a postmortem, during an autopsy in the morgue, I don't have to give any of those drugs. So what I've come to understand is these people are in no way dead. So now I'm looking at slide 4, Gail. So when is someone dead? We need to make our definition so we know what we're talking about. You know, most people I meet define death as the separation of the soul or the spirit or the life principle, the life force from the body. And we don't have any device to detect when something immaterial departs. So historically, you know, for thousands of years, you didn't need a doctor to tell someone, are they dead or alive? That people would look and they'd see that this person might have stopped breathing. They might have lost their pulse. They would grow gradually cold and stiff. So the loss of heart rate, breathing, and the passage of time beyond any possibility of resuscitation historically had always been how death was defined. But in 1968, if you go to slide 5, the definition was changed. You know, right after Dr. Christian Barnard did the first 2 heart transplants in South Africa, 13 men at Harvard Medical School decided, you know, we really need to start doing these in America. Up till then, in the US, transplant surgery had not been terribly successful because if you take an organ, as we mentioned earlier, from a bona fide corpse, it really has undergone so much destruction from being under a low oxygen state. They didn't do very well. But these 13 men at Harvard thought if we would redefine people in a deep coma as being somehow dead, that would solve this situation and get us a whole bunch more organs that we could use for transplantation. If you read this article, this is the landmark article that's shown there from the Journal of the American Medical Association. The committee never described these people as being dead. In fact, they described them as being desperately injured. And they also said these people were a burden to themselves and others. And they said this new definition of defining people in a coma, people who had always heretofore been considered to be alive, would have the important social utilitarian benefits of freeing up ICU beds, and it would remove the controversy over using comatose people as organ donors. Now, did they have any facts, studies, evidence that these people were dead? Well, no, this paper that they published has 0 scientific references. You can go to the next slide, Gail. If you think about it, though, this redefinition was of very great utility because it allows organ procurement to skirt what's known as the dead donor rule by the stroke of a pen saying these people are now somehow dead. The dead donor rule is not a law, but it's a universal ethical maxim that says people must not be alive when their organs are removed, nor may they be killed by the process of organ removal. But if you redefine someone, okay, now you're dead. Now you've met the dead donor rule by sleight of hand. And if you go to the next slide, it wasn't until a couple of years later that actual studies to look at this were performed. The National Institute of Neurologic Diseases and Stroke study from 1970 to 72 was the first and only prospective multi-center study of the autopsy findings in brain death. And what they found of 226 brains autopsied, people who had been declared brain dead using criteria that are actually stricter than what we use today, 10 were grossly normal, and only 40%, less than half, showed diffuse tissue destruction. So the authors had to include that it wasn't even possible to verify that a diagnosis made before cardiac arrest, which is the traditional criteria, would invariably correlate with a diffusely destroyed brain. And on the next slide, the principal investigator, Dr. Molinari, had to say that brain death was a prognosis of death. Now, a prognosis means death might go on to occur, but it hasn't happened yet. And he wondered if a fatal prognosis was enough to allow the physician to pronounce death. He said it's highly doubtful whether such glib euphemisms as he's practically dead, he can't survive, he has no chance of recovery anyway, will ever be acceptable legally or morally as a pronouncement that death has occurred. But what we all know is that is exactly what we have accepted. We have accepted the prognosis of brain death as being good enough to call someone legally dead. And if you go to the next slide, that's where legal death was defined. In 1981, a President's Commission said that brain death could be considered death because according to the testimony they received in 1981, these people would very quickly go on to die without the brain, which was considered to be somehow the master integrator of the body. Again, their argument was based on brain death being a prognosis of death, not a diagnosis. And that's really what we were all taught, even in the 80s when I did my training. We were told that, without a functional brain, these people would very quickly go on to die biologically. The only problem, it didn't turn out to be true. But despite that, this is where if you go to the next slide, the Uniform Determination of Death Act, our legal definition of death in the US came from. So under the UDDA, you can be defined to be dead either the traditional criteria, the loss of circulatory and respiratory function, or the new neurologic criteria, which is the irreversible cessation of all functions of the entire brain, including the brain stem. Go to the next slide, but guess what? This was disproved. It was proved not to be true that people with brain failure would go on to biological death. In 1998, Dr. Alan Schumann, a pediatric neurologist, went and did a literature search and found 175 cases of brain dead people who continue to live after the declarations of their death under the UDDA law, one for more than 20 years. Now, all of these people were brain dead enough to have been offered the opportunity to become organ donors. But for one reason or another, their families determined to leave them living. The 20-year case was a case of a 4-year-old boy who had meningitis. And this meningitis was very severe. It was so severe, it actually split the sutures of his skull. All little babies, their skull isn't all the way fused. Well, 4-year-olds, they are fused, but his brain swelled so much, it split those sutures back open again. But his mother determined that she would like to continue to care for him. And so, she took him home. She cared for him in her home with a ventilator and a feeding tube for 20 years until he eventually died of a heart attack. I spoke with Dr. Paul Byrne, who was involved with this case, and he asked the mothers, is your son difficult to care for? And she said, no, not really. He gets a urinary tract infection once in a while, but if I give him antibiotics through his G-tube, it goes away. He's quite easy to care for. He was very stable. When he came to die, she allowed an autopsy to be performed. And when they opened his head, there was no brain tissue whatsoever. There was a small walnut-sized hard mass that they couldn't even cut with a knife. They had to use a saw, and they couldn't find any brain tissue at all. So the brain is, as counterintuitive as it might seem, the brain is not 100% necessary for people to continue to live. And that's what Dr. Schumann proved. If you go to the next slide, because of Dr. Schumann's findings, another President's Council was convened in 2008, and they agreed with Dr. Schumann. They said the brain is not the integrator of the body's many and varied function. This integration is a property of the whole organism. It doesn't depend on directions from one part. It's a product of the orchestration of multiple parts. If you go to the next slide. So now the President's Council had a problem. They had to either decide, this brain death, we have to throw it out, or we have to come up with a new rationale, since a biological rationale was now known not to be valid. So, as we all know, they kept the brain death idea, but they based it now on a questionable philosophy rather than on biology. They coined the term total brain failure, and they said you're no longer alive when you can't do the fundamental vital work of a living organism. For no reason at all that anyone can understand, it seemed pretty arbitrary. They decided if you are unconscious and you need a ventilator to help you breathe, you're as good as dead. Now, this is arbitrary. I mean, to take an arbitrary level of disability to make a person as good as dead is absolutely wrong. And if you go to the next slide, the President's Council did not reflect accurately the scientific facts. In the first place, total brain failure is inaccurate. People with a clinical diagnosis of brain death still have certain brain functions. I mean, 20% of those tested, and of course, not many are tested anymore because they withdrew the requirement for EEG many years ago. 20% still have brain waves on their EEG, which is a brain function, and over half still have a part of the brain called the hypothalamus functioning, and that is a part of the brain. You remember I told you earlier, the legal definition is the irreversible cessation of all functions of the entire brain, including the brainstem. We know over half still have functioning brain matter going on. And the hypothalamus, I mean, we don't often think about our hypothalamus and what it's doing there, but the hypothalamus is an important part of the brain. It's responsible for temperature control, blood pressure management, sex drive, awareness, and pain. And over half of people with a diagnosis of brain death still have that functioning. And then, of course, people with a brain death diagnosis still have metabolism. They digest food and excrete waste. They heal their wounds. They fight infections. They can deliver healthy babies. And they all have a stress response to the incision to remove organs, as I saw when I did my case back when I was an anesthesiology resident. So now I'm looking at the next slide, Gail, with Zach Dunlap. Zach Dunlap is a famous case. He was a young man who flipped over his four-wheeler ATV and landed on his head on the pavement and had a severe brain injury. He had brain matter coming out of his ear canal, in fact. He was so unstable because of his injuries, they couldn't do some of the usual tests, which brings up sort of an incoherence in the American Academy of Neurology brain death guideline. They say that if you can't do the usual tests, then you're going to base the brain death diagnosis on what's called an ancillary study. And so Zach's brain death diagnosis was 100% hinged on what was read as a no-flow cerebral perfusion scan. Now, later, nuclear medicine experts who reviewed the scan were divided. 2 out of 3 thought maybe there was a slight amount of flow. Of course, they had the knowledge of hindsight on their side, but the third one agreed with Zach's doctor that there was no flow. If you go to the next slide, the brain death guideline, however, admits all ancillary tests have shortcomings and none are 100% sensitive or specific for a diagnosis of brain death. So now Zach and other people like him, their diagnosis of brain death is hinging on a test known not to be 100% accurate. If you go to the next slide, thankfully, Zach had a cousin who was a nurse from another facility, and Zach's cousin didn't think he was dead. So he scraped the bottom of Zach's foot with his pocket knife, his closed pocket knife, and Zach withdrew his leg. And so the cousin called the nurse and said, look, my cousin's moving. And the nurse said, well, they tell us in brain death school that they can be moving, but they're still dead. So then Zach's cousin pinched Zach's nail bed, and Zach pretty much took a swing at him. And the nurse said, oh, wait, that movement crossed the midline, so that one counts. So just as the helicopter with the team to remove Zach's organs was landing, the whole thing got called off. Zach made a full recovery. He's gotten married. He has a little girl. He works a job. But one of the most disturbing things about the Zach Dunlap case to me as an anesthesiologist was that Zach reported later that he heard every word as doctors were telling his parents that he was somehow dead and could now become an organ donor. And this is something Jenny's going to bring up when she speaks later, because she told me a very similar story. Zach said there was nothing I could do. I couldn't move. I couldn't scream. I tried to sign. I could just get extremely angry. Now, if you just imagine if it wasn't for Zach's cousin and this had all progressed, to someone like, me when I was a resident, taking him to the operating room, I wasn't going to give him anything to block consciousness. I was just going to give him a paralyzing agent in medicine to control the blood pressure. Can you imagine the horror that Zach would have experienced if he had run into someone like that? And it's absolutely true. I can show you anesthesiology review articles about the management of the brain dead patient that say not one word about giving an actual anesthetic, just paralyzing medication. So I'm here to tell you, this has happened to people. This has happened. What Zach avoided has happened to people. The next slide shows Jahai McMath. Jahai is another famous case. She was a 13-year-old who had postoperative bleeding and cardiac arrest after a tonsillectomy and palate repair for sleep apnea. She was declared somehow dead 3 days after her cardiac arrest. Her mother looked at Jahai, and she didn't look dead. I mean, she was warm. She had a blood pressure. She had a heart rate. She was moving at times. She looked like all the other children in the ICU who were getting better. But the doctors were telling her that your daughter's dead and she can become an organ donor. Well, Jahai's mom was a Christian and didn't believe that her daughter would be dead until her heart stopped beating. So she got help from Dr. Paul Byrne, who's helped many people victimized by a brain death diagnosis. And she was transferred to New Jersey, the only state where there's a religious exemption to brain death, where she began to improve. And people say, well, if she got better, she probably was just misdiagnosed. Those doctors back in California probably didn't know what they were doing. They made a mistake. Well, I'm here to tell you, she is so well documented. Her medical records have been released. They've been printed in medical journals. Jahai McMath was unquestionably properly diagnosed as being brain dead in California. She had 3 doctors who declared her to be brain dead, one of whom was the chief of child neurology at Stanford. He knew what he was supposed to do, and he did it. She had failed to breathe when they disconnected her from her ventilator on 3 apnea tests. She had 4 flatline EEGs and a no-flow cerebral perfusion scan. So according to the guideline, she had been correctly diagnosed. But when she was moved to New Jersey and they actually cared for her, I mean, in California, they had starved her for 3 weeks because they said she was dead. She began to improve. She went through puberty and she got her period. I mean, how many corpses do you know that menstruate? Her mother began to notice that Jahai's heart rate would calm down when the music therapist played the harp or when her mother would speak. So her mother began to videotape some of these correct responses. And after Jahai had been moved to her mother's apartment in New Jersey on a home ventilator and on a feeding tube, Jahai continued to get better. And it's a bit of a crude example, but to prove that her daughter was consciously responding, her mother actually asked her, Jahai, which is the FU finger? And recorded Jahai putting up the correct digit. I mean, this little girl was in no way dead. And later, 2 doctors, Dr. Calixto Mikado and Dr. Alan Schumann, evaluated Jahai and found that she was no longer brain dead. She no longer met the criteria. She now had brain waves and she was showing signs of consciousness. So if you go to the next slide, people ask me, how can people survive brain death? I mean, how does that even work? Well, Dr. Cicero Coimbra, a Brazilian neurologist, actually described how this works in 1999. It's got a $10 name, Global Ischemic Penumbra, but it's really very easy to understand. It's kind of like a power outage of the brain. If you go to the next slide, when there's a brain injury, the brain swells and that decreases the ability of the blood flow to get to the brain. And so a brain injury has low blood flow. So during periods of low blood flow, the brain, like any other organ, shuts down its functions to reduce its energy requirements. And at about a 50% reduction in blood flow, the EEG will become flatline and the brain becomes unresponsive to testing. Okay, if you test the brain at this point, it won't respond. You'll think this person is brain dead. But actual tissue breakdown, tissue necrosis, that doesn't start until the brain blood flow is dropped below 20% of normal for several hours. So between 20 and 50% of normal blood flow, there's not enough blood flow to support function, but there is enough flow to maintain viability of the brain. So if you go to the next slide, this GIP perfectly mimics brain death, but it's potentially reversible if you treat it. I liken this to a power outage in your home. If you have a power outage in your home, you can go to the next slide, Gail. Nothing works, right, when there's a power outage, but the wiring isn't destroyed. Get that current flowing again and the lights will come back on. And GIP in a brain injured patient is very similar. Nothing's working, but the tissue isn't destroyed. Get that cerebral blood flow flowing again. And, for proportion of these people, the lights could come back on. And this exactly explains these brain death survivors that Gail showed you on my website earlier. If you want to go ahead to the next slide, Gail. The problem that we're in right now, the American Academy of Neurology guideline, as I mentioned earlier, allows people with ongoing brain function to be declared dead. And this does not comply with the law under the UDDA. So over the period of about 2021 to 23, the Uniform Law Commission was petitioned by the American Academy of Neurology and others to revise the law to reflect what doctors are doing. You know, I was an observer to the Uniform Law Commission, and I watched their annual meeting in Honolulu as the study group presented this idea to the Uniform Law Commission, the body of the lawyers there. And the lawyers said, wait a minute, you're asking us to change the law to accommodate doctors who are violating it? Why don't we ask the doctors to adhere to the law? And it went nowhere. And so in September of 23, the Uniform Law Commission declined to revise the Uniform Determination of Death Act to accommodate the AAN guideline. Well, undeterred, 3 weeks later, the AAN published their new brain death guideline that continues to allow people with brain functioning to be declared dead. Now, did they have any new studies, facts, or data to support this? Well, the next slide shows their methods section on their paper. It says in that highlighted area, because of the lack of high quality evidence on the subject, a novel evidence-informed formal consensus process was used. Basically, these people decided the brain death guideline with 3 rounds of anonymous voting among a panel of experts that had been specifically screened to exclude those who might disagree. Now, think about this, the lack of high quality evidence. We have been declaring people to be brain dead for nearly 60 years. Wouldn't you think there'd be some high quality evidence for it by now? And if you go to the next slide, it looks complicated, but I'm going to make this real simple. There are 4 pillars of the brain death exam. The first one is unresponsiveness, right? But the inability to respond is not the same thing as unconsciousness, as Jenny will tell you from her experience. And if you remember with Zach Dunlap too, he did not respond very well, but he was inwardly aware and listening to everything. So unresponsiveness is not a good criteria. Doctors, in fact, have no way of knowing if you are inwardly aware. We can only tell if you're able and willing to respond, which is not the same thing. The second pillar is there can't be any motor response to a painful stimulus. The guideline, though, says it can sometimes be challenging to determine whether a movement is cerebrally or spinally mediated based solely on clinical examination. So the guideline goes on to say if you're not sure whether your moving patient is dead or alive, they tell you to ask a senior colleague, ask a friend, for pity's sake, is what they say. Now, that's really subjective. And they allow certain motions. You remember the nurse in Zach Dunlap's case saw him pick a limb off the bed and said, oh, that doesn't count. Other motions that don't count, they list them in a table. That you can be reaching up towards your throat like the universal sign of choking, and they say that's a reflex. The strangest one I find, they say that if you open your eyelids with nipple stimulation, that could be a reflex too. So this is very subjective. The third column is the neurologic exam. Now remember, the law says the irreversible cessation of all functions of the entire brain, including the brain stem. Let's see, here on the neurologic exam, there's 1, 2, 3, 4, 5 brainstem reflexes that are checked. I mean, that is by no stretch of the imagination all functions of the entire brain. And the last is the apnea test, in which they discontinue the ventilator and check if the patient breathes spontaneously. And they give parameters for it. But the guideline says selection of targets for this challenge is arbitrary because they don't have scientific data to demonstrate what the parameters should be. So this is not a scientific guideline. I'm going to go to the next one. This is a picture of Dr. Elko Vidix. He's a neurocritical care specialist at Mayo Clinic. He wrote that last guideline and the 2 previous ones to that. So he's deep into the brain death diagnosis, but he maybe in a bit of a slip of a tongue stated at a Vatican conference in 2006, the diagnosis of brain death is driven by whether there's a transplantation program or whether there are transplantation surgeons. I do not think brain death examination now in practice would have much, if any, meaning if it were not for the sake of transplantation. So I'm going to just conclude this section of the talk on brain death with the next slide. I got to tell you, the emperor brain death has no close. I mean, the concept of brain death was proposed without scientific validation as a utilitarian social construct, and it continues to be controversial. And so I believe justice dictates that the public must be made aware of these facts, especially when they're asked to register to become an organ donor. So Gail, before we go on to the other things besides brain death, do you want to bring Jenny on and talk?
Yeah, I do. I want to first just play a little. So there's one thing about the whole brain death going into the organ donation piece that has always felt a bit propaganda-y to me. And Dr. Aranda touched on it last night. So there's this video, and I'm not going to play the whole video because it's it's 7 minutes. But there's this video that just bothers me. So I'm just going to play a short bit of it, and then we'll have a discussion about what people are watching.
Tell me about that day.
We were there saying our goodbyes. That was it. We felt like we were doing the right thing as a family, and they were trying to kill him. We had made the decision to remove him from life support because we were told, he was brain dead.
What you are watching is the honor walk. It's one of the most revered traditions in a hospital. It's when family, friends, and staff all pay their respects as someone is wheeled off to give the ultimate gift, donation of their organs.
It's okay.
Except this man, T.J. Hoover, was still very much alive.
So out of respect for more and for the patient's privacy, if we can stop recording at this point.
So, that seems very much like gaslighting the family to me. They knew that he wasn't dead, because the whole concept of brain dead is just one big falsehood, right? And so the family's kissing him goodbye. They think they're doing something noble. And then he wakes up. So Jenny, you've lived this. Tell people a little bit about your experience, and because I know everybody's out probably. People have a million questions. If you have questions, put them in the comments and we'll pull them up real time. But tell people about your experience and what you think when you watch that.
My experience was it was over 40 years ago. Mm-hmm. I have a history of epilepsy, and I had a bad reaction to a medication that caused me to go into something called status epilepticus. That means continuous and repeated seizures. So over a period of 10 hours, I was in and out of seizures. The seizures I went on for 10 hours, and I coded twice during that time. And I have a full memory of the first code. I actually had an out-of-body experience and saw them working on me and reviving my body, and came back. I don't recall the second code. my next memory after the first code was in ICU. So that happened, the codes happened in the ER. And then in the ICU, I could hear and understand things that were going on around me, but I couldn't move. I couldn't speak. I couldn't open my eyes. I couldn't interact in any way. But I had, I think of it as awake and asleep times. Even in that state, I had awake times and I had asleep times. I had times when I was not aware of what's going on around me, and I had times when I was very aware. Like when anybody goes to sleep, they don't know what's going on around them, right? So I heard nurses, some really good nurses. They would talk to me. They'd tell me what the weather was like, what was going on in the world, tell me, I had visitors or whatever, what they were going to be doing, why they were in the room. And then I had nurses that were not so good. They did not communicate with me at all. They came in and they did their job and then they left. And I actually began to recognize the sounds people made, and could, in my mind, I could identify, oh, it's that one, or it's that woman, or this person. I gave them names in my mind because they did not introduce themselves to me. And I remember one nurse came in and I finally heard her voice for the first time. She was one who was always a little brusque in her movement, and she was a little rough. She never spoke to me, but this time she spoke and she called out, "Would someone come in here and help me turn this thing?" She was speaking of me as a thing that she needed help turning me. So, I believe good comes out of everything. There's, God uses everything. And in that moment, I made the decision to go back to school and become a nurse. So it was the contrast between the good nurses and the awful nurse that spurred my decision to go back to school and become a nurse, which I did later on. But another memory, I remember my husband visiting and begging me to come through this because he just couldn't do it. He couldn't raise our kids without me. He needed me. And then I remember a nurse that was always kind. She always spoke to me and talked to me, and we'll come back to her in a little bit, but she saved my life. That nurse did. There was one time multiple footsteps came into the room. I don't know how many people there were. And a male voice spoke saying, "Oh, this one's a sad case. Young woman, little kids at home, and essentially brain dead. Her husband is being completely unreasonable. Other than the fact that she's a vegetable, her organs are in excellent condition, and so many people could benefit from her organs if he would just sign the paperwork." And another voice said, "Doctor, is it appropriate to talk that way in front of the patient?" And he said, "Hello, I told you she's brain dead." And I remember my thoughts were, you can't have my organs. I need my organs. I've got a life to live. I've got my children to raise. I needed my organs. And some time went by. I don't know, a couple more days. And there were multiple people came into the room again. And this time they were going to stop the respirator. And they were doing what's called an apnea test. So, and like Heidi explained a little bit about the apnea test, they basically, it's a self-fulfilling prophecy is what it is. What they're going to do is they're going to turn off your respirator and they're going to say, "Oh, she did not take a breath. That proves that she's brain dead." So My favorite nurse, Nancy, was in the room with me when they did the apnea test. And she kept whispering in my ear, telling me, you must breathe. You've got to take a breath. Come on, you have to breathe. And I remember thinking, breathe? I know how to do that. Yeah, I can do that. And I did. I took a very agonized, very difficult breath. And the doctor cursed. So, because it wasn't the result he wanted. It proved I'm not brain dead, and he could not proceed with harvesting my organs. I'm a person who likes to give people the benefit of the doubt. I'd like to believe that this doctor just didn't know. He really, truly believed I was dead, and that there was nothing greedy or nefarious about it. But remember, I had been in status epilepticus for 10 hours. 1 minute of seizure takes about 4 hours recovery. If you think consecutively, 10 hours would be 100 days recovery. And they were declaring me brain dead within a couple of days. And they were loading me with neurosuppressants because of the seizure activity. So you're giving someone a medication that suppresses their brainwave activity and then saying they don't have brainwave activity, so they're brain dead, right, so we can take their organs.
That's insanity. How did you feel when it had to have felt like you were surrounded by mostly people who didn't want you to live?
No, I would say there were as many good characters as there were not. Sure. Yeah. I don't think it was the majority who, desired me to not make it. But I do think, who is it? Who's that famous quote that says, for evil to triumph, you just need good men to do nothing?
Yeah, right. Yeah.
And I think that's what happens is you have good people, but they maybe they're not knowledgeable enough to argue something, or they don't feel confident enough, or they feel outnumbered.
I think more so now than 40 years ago. I mean, it's gone downhill because respect for life has gone downhill, right? Like, I mean, there's less respect
in every category.
Yeah.
And I don't know why people are surprised about a lack of respect for life in one category when it's kind of across the board. Right. I mean, if there's not respect for life in all these other areas, why would you expect respect for life for that?
At any age or any condition or any, anything.
That was one of the things I later did go back to nursing school. I came out of this, obviously, and I recovered fully. It took time. They were not nourishing me.
Yeah.
I had a nasogastric tube and I had the respirator. They did then resume the respiration because my breathing wasn't efficient enough yet. So they did start the respirator again. But then later, when they were taking me off the respirator, instead of the cold turkey thing, they did wean me off, right? And they did it as a gradual process. And we know that. We as healthcare professionals know that you don't just stop a respirator and expect a person to be functioning well. Someone who's on a respirator, their body literally forgets how to breathe on its own. Plus, they give them medications to suppress their respiration so that they won't fight the respirator.
Right.
So, like I said, it is a completely self-fulfilling prophecy. I don't know if they stop those medications before doing the apnea test. I don't know. I just know that they stopped the respirator, and Nancy saved my life by telling me I needed to breathe.
Yeah, that
Can
right
I
there.
ask you a question, Jenny?
Yes.
I'm a nurse as well, and I just wanted to kind of touch base with you a little bit because you went through this experience and through it when Nancy saved your life and you became a nurse. I'd love it to see if you could just tell us a little bit about how that experience has impacted you as a healthcare provider, because I can imagine the education that you do. I can imagine the advocacy that you do. I can imagine I would, as a nurse, I would be in awe working with somebody who had that experience and then could intervene with those who may be going through the same situation.
Yeah, it did have a huge impact on my nursing and my practice. I was one who would speak with my peers and make sure that every patient is treated with dignity and respect, regardless of their state, stage, or condition. That there is no exception. These are human beings. I hated when I would hear somebody referred to as a vegetable, and I would correct them at that time, and I would say, a human being cannot be a vegetable. There is nothing that can happen medically to a person that changes their DNA from human to broccoli.
Right.
There's no human vegetable, period. So please do not use that term again. This is a person. Call them by name. They have a name. And I kind of went up the ladder pretty quickly in my nursing career, and went to a nurse manager and then an assistant director of nursing and the director of nursing. Later on, I taught, went back to my alma mater and I taught. And I was always reinforcing that every single patient must be treated with dignity and respect. And it's not our position, not our place to dehumanize. And that's it. This whole society, they dehumanize people. Anyone who differs in some way is dehumanized. Yeah. It could be the stage of life. It could be they're not born yet. They're still in the womb. They're not human. They're very old and they don't know how to do things anymore. They've dementia. They're not human anymore. Maybe they're profoundly disabled. They're not human. We even dehumanize people who are different, that are, full able-bodied people. And they're just different from us in some way. And we find ways to refer to people as something other than human. Yeah. You call this one an animal, or, I think we as human beings, we need to recognize when another human being is being dehumanized. And we need to be willing to do the hard thing. Yeah. To be willing to stand up and say, no.
Yeah. On our hospital deadly playbook on our website, patrolprojectusa.org, we have 25 tactics that hospitals used, and one of them is what is it? It is number 19 is dehumanization. Victims, just survivors, and even families of those who died had described their loved ones being treated as animals. And when my husband stormed the ICU to save me because he wasn't gonna let me die, and they wouldn't let him in. He being a former nurse, and he was horrified by what he saw. I was being treated like an animal, naked and uncovered, so they wouldn't have to come in and they could just look in at me, and filthy, laying, my hair matted. It was a totally different world. There were very few good nurses and doctors in the last 5-6 years that took care of patients, but that's something that we hear very much, is being patients having been treated worse than animals, in my opinion. I often say, to get people to care about medical crimes, if we showed them animals being treated the way people are being treated, there would be an uprising. There would be so many people that would be demanding justice for puppies or dogs that were treated. And I love puppies. I've got puppies. Like, I love puppies. Now, don't think I don't love puppies, but the fact that people are not demanding it for human beings. And you touched on something about, when people are disabled or people are, there's not a respect for life. We see that almost as if these doctors and nurses or medical professionals think they're doing the families a favor. It's this self-righteous, we're putting somebody out of their misery. You don't have to take care of them. Like what you said about the vegetable, you don't change from a human being to broccoli.
Mm-hmm.
Very profound.
Well, it's such an ethical issue. I didn't mean to jump in, Matt. I didn't mean to cut you off, but it's such an ethical issue. And, people want to talk about it as a medical conversation, but really, when you're getting down to brain death and organ harvesting and all of this, there's a very serious intersection here. I mean, you're talking life, you're talking death, you're talking about people being made to make a decision at a very heightened time under mass amounts of pressure. And it's like, make a decision, make a decision, make a decision. And they're putting a demand and supply over the sanctity of life. That's one of the things that I think that gets overlooked, is they talk about they have ethics commissions and all this in the hospital. But this is a huge ethical issue. It's a huge ethical violation. And I can remember being in a situation twice where there was pronouncement of brain death. The parents said, no, my son is not going to be taken off the vent. And he woke up, and twice I've seen that happen. So, I mean, can you maybe talk a little bit about that as well? Because that's such a serious issue. How can you have an ethics meeting when you're talking about getting rid of people?
I do want to make a point about that, Mick, that you're talking about people who have a very secular view of ethics and life versus what we would think of in a Christian world of ethics. It's a totally different thought process as to
not necessarily, Gail. For several years, I was executive director of California Nurses for Ethical Standards. It was at that time the only statewide pro-life nurses organization in California.
Yeah.
And I got a call and a request to help a family talk to the ethics committee at a Catholic hospital. Now, I'm Catholic.
Yeah, me too.
And I know Catholic Church teaching on this. And I have studied the ethical and religious directives for Catholic healthcare services that is put out by the United States Catholic Conference of Catholic Bishops. So I know the ERDs, I know what the guidelines are. I understand it. And I went to this ethics committee meeting at a Catholic hospital, and I was the only one there that was arguing in favor of life. And this man who had he was diabetic, and he'd had a diabetic crisis, and they wanted to discontinue nutrition and hydration. and just let him starve to death and dehydrate to death. And his family did not want it, but his next of kin, the closest family member, was his son, and his son didn't want, just wanted things to go fast. And so we fought and we fought. We lost. We lost that fight at a Catholic hospital. So yes, I hear what you're saying, Gail, that, you know, in the secular world.
Yeah.
But
It's a secular
this
view.
is, you can't even trust you can't even trust those in the Christian world, because most of them were educated secularly.
Well, that's true, and I do mean when corporations take over and all of that, because I don't think that, like, my husband always talks about the days, you know, he learned his nursing from the nuns, and everything was slower, and it was all, you know, there people were educated and they cared for the whole mind body. He's old, he's retired, so he's like, you know, he's older,
Holistically. Yeah.
and so
Gail,
yeah, go
Gail,
ahead.
Marsha told us the same thing last night about hospice. That you can't even trust Christian hospices. So there's that.
That's
There's
true.
that overlap here. And but the other thing I was I thought about as you guys were talking is that same dehumanization that Jennifer talked about. That was the premise of slavery. It's also the premise of abortion, to tie in a couple of other things. But I also want. I actually had two questions though. I want to know if there's any overlap between brain death and hospice, if any of those brain deaths that Heidi mentioned occurred in hospice. And I also want to know from Jenny, how much time passed between the ER and the ICU? Like, how long were you dead? Were you declared brain death before you recovered and were not declared?
Altogether, I was okay. So after the apnea test, it was a couple days later. My feet reacted when they ran the instrument up my foot. I had a reaction, and the nurse in the room got very excited. Did you see that, doctor? Did you see that? And I said, let's check the other foot. And the other foot reacted as well. So he said, okay, I think she's on her way back. And it was another day after that or so when Nancy came into the room again. And my desire to see Nancy was so great because this woman had saved my life. I so strongly wanted to see her. I was finally able to open my eyes. And she noticed. Some other nurse might not even have noticed if I opened my eyes, but she noticed, and right away she was like, well, welcome back. How you doing? And I wasn't able to speak. It took time. But they extubated me, and then I had to have a little therapy, and then I was able to be checked by speech therapy to see if I could swallow safely. And they gradually started introducing solid food to me again, beginning with applesauce. But before, when I finally got transferred out of ICU, it was only a few weeks.
Wow.
I wasn't really, we're not talking months and months. They gave up on me very early on and declared me brain dead very early on.
Wow.
And the thing is, according to the ICD-10, right?
Yeah.
Mm-hmm.
The brain death is defined as a state of prolonged, irreversible cessation of all brain activity, including lower brainstem function, with the complete absence of voluntary movements, responses to stimuli, brainstem reflexes, and spontaneous respirations. Notice it didn't provide criteria for what does it mean by prolonged.
Right. Was it the same?
So in my case, prolonged was just hours.
Yeah. Right.
Wow.
And was that the same? Was that the same when this happened to you, or
Well,
has
it was
that
a different ICD. It was an earlier edition of ICD, but it was still that similar. The ICD-9 was the same, and I don't know what the ICD was back in 1985.
Yeah.
But currently, the American Academy of Neurology brain death guideline for adults allows brain death to be declared 24 hours after injury.
Wow.
Think about that. I mean, the brain swelling has had no chance to come down. I mean, if you've ever had a sprained ankle, you know the swelling doesn't come down in 24 hours. They are rushing this.
I see that, and I see that you know, people being rushed to make that decision and pushed.
And remember, they're giving medications to people who have severe brain injuries to
keep them from
kind of do it.
moving.
It's like an artificially induced coma, right?
Yeah.
And
Right.
and giving them those medications, and in my case, like I can't even remember what medication is it, Heidi, that they would give to stop seizures.
Dilantin.
Probably back in your day, it was probably just Valium, I suppose.
Yeah, probably Valium.
Phenobarbital, maybe.
But the Valium, and so, you know, and the thing is, the seizures were brought on because I went on a medication that is contraindicated for persons with central nervous system disorders.
Oh, wow. Yeah. Teresa has a question. This is probably for Dr. Heidi Klessig. Who owns the organs once hospital patient is declared dead if they are an organ donor?
So there are regional organ procurement organizations, and they are the ones that come in. Your own doctor actually anymore is not supposed to talk to you or your family. Your own nurse is not supposed to talk to the family. They really want the organ procurement organization personnel who've been trained to know how to approach people in a time of crisis and have the highest probability of getting them to sign up to become make their loved one an organ donor. So then those people take over, and a lot of these people then are given better medical care than they've ever had in their entire life because they want those organs to be in good shape. These people go and are put through procedures like, if they want to know, is this heart a good heart to harvest? That person will get a cardiac catheterization procedure. Almost everyone who is going to be an organ donor gets a bronchoscopy in which a tube is put down the lungs and scoped to see, are those lungs in good shape? You know, it's really unethical to put people through painful tests that are not going to give them any benefit, that are only going to be of benefit to people who might receive the organ. So these are really unethical tests. But then the organ procurement people go ahead and get the organs, and then they are the ones in charge of matching them with another recipient, making sure that the organs travel to the proper place and coordinating all of that. And people ask me, what kind of dollars and cents are involved when organs are taken like this. The Milliman Actuarial Company comes out every 5 years with the billable charges for organs. And so they just came out in 2025 with their update. I have that on our website. If you push the button, what is a body worth? What they said is, if you say you give away your body for free, right? And they take the heart, the lungs, the kidneys, some pancreas, liver, some intestine. Just those organs are worth over $8 million in billable charges. And that's not even the tissues. The tissues we haven't talked about. Tissues are things like the skin, the bone, the corneas, the heart valves. Tissues, interestingly, can be taken from someone who is biologically dead, a corpse, because tissues are much simple structures and they are more resilient to a low oxygen status. So tissues then can be taken, and many people say, I want to donate to help people and save lives. A lot of these tissues are actually sold into cosmetic surgery procedures. And I was just reading an article about the fat that's taken from donated bodies. It's purified and it's sold to puff up lips, buttocks, other parts of the body that I won't name that people want enhanced. So when you donate your body, you might end up riding around in someone's Brazilian butt lift.
Mhm.
Wow. Wow. Then and the honor walk is meaningless for that.
Now, Heidi, you might know more about this than I, but I believe, and correct me if I'm wrong, I think that the laws are the family members cannot profit in any way from organ donation. So no money can go to the family. The hospital is not supposed to be able to, quote, sell the organs. They just distribute them. However, each hospital that performs transplant surgeries makes a lot of money through the surgical process. There's a lot of money to be made by performing the surgery. So the organ itself may not have a, quote, price tag, but the transplant of that organ is not. It's big ticket, big money.
Yes.
Well, that's what I was going to say, because I know when I was working in the ICU and, Life Share, the organ donation procurement would come through. One of the things that I always wanted them to do was to have, and I don't know, maybe they did do this and I just wasn't part of it, but I never saw them do like an extensive informed consent. What tests were going to be done to determine that there was, brain death? Did they do apnea tests? Did they do EEGs? Was there any information, education done on that? Again, if there was any chance that there could be a reassessment or a variability, I never hear of that being discussed with the family. I never hear about or ever saw that there were things like explained to the family of what would happen next, like all the testing that they're doing. They're sending them through the cardiac catheterizations, doing the bronchoscopies. None of that, in my opinion, gets explained. Correct me if I'm wrong, but that's a real concern to me, because that again goes back to, we have a lack of informed consent. They are not aware of what has been done, why, and what comes next for what reason.
You are absolutely right, Mac. There is no informed consent from beginning to end. I mean, remember when you were getting your driver's license and the person behind the desk who has no medical or legal training asks you if you want to be an organ donor. Did they give you any type of informed consent? No, of course they didn't. And even if they did, they probably wouldn't know how to explain it. I mean, if you go to organdonor.gov, the explanations they have about donation after brain death and donation after circulatory death are both incorrect. So even if you looked up to try to inform yourself on our government website, it would be wrong. And you're right, the organ procurement people certainly aren't going to tell you, the risk, the benefit, the procedure, and the rationale, because if you heard what those things were like, you would just choke and you wouldn't sign on the dotted line. In fact, the American College of Physicians, which is the world's largest specialty medical organization, just last fall put out a position paper saying that these medical tests for the benefit of the organs and not for the patient are unethical. I don't think anyone's being told that when they're being signed up by the OPO. There's a cloak of silence going on that has to be stopped.
How much of that do the medical professionals who are tending to these and who are giving that sort of care, how much of that, of what you just mentioned, do they know?
I don't think most of them know very much about it. If I always try to hold out the olive branch to doctors and nurses, because the amount of knowledge doctors and nurses are responsible for is so vast. There is no way possible doctors and nurses can personally investigate everything they are taught. They are forced to take a lot, almost everything really, on authority. And probably their authorities took it on the authority of those before them. And that was my case too. I came in and my authorities told me this is the way we do it. And I believed them. It wasn't until I had time later in life to read the primary source documents for myself that I learned, to my horror, that doctors, lawyers, philosophers, scholars have been fiercely debating the ethics of these procedures in the academic literature. But, as Nick said, the public is never informed about this. And I find that very unjust.
So let me, do you want me to pull your presentation back up are there any slides that we need to hit with regard to organ donation?
I would like to just talk about donation after circulatory death, because that is actually the up and comer. Almost 50% of organ donations are via this method. And people say, well, if my heart stops, surely I am dead then. And that's what I want to explain to people. These donors also are not known to be dead. So if you go to the next slide, donation after controlled circulatory death came up in the 1990s as a way of expanding the donor pool. These people are not brain dead, but they have a poor prognosis. They're not expected to survive, or perhaps they've decided they would like to have their support withdrawn because they don't think their quality of life is acceptable. So their death becomes a planned event, planned to occur at a specific time and place so organs can be harvested. If you go to the next slide, these people have to be made do not resuscitate. They all could be resuscitated, but a decision has been made not to resuscitate them. So strictly, their death does not meet the letter of the law, which is the irreversible cessation of circulatory and respiratory functions. All of these people could have those things reversed. And so their deaths are, again, a very gray area under the law. If you go to the next slide, it shows how this happens. The patient is made a do not resuscitate order and taken to the operating room, and the ventilator and the drips and the support is withdrawn, and the patient is often given sedation to just help them, not, feel too miserable as they're gasping away their life. It's really tragic, until their pulse stops. And so then, depending on where you live, in my state of Wisconsin, it's 2 minutes. In other states, it's 5 minutes. Doctors observe after that pulse stops a 2 to 5 minute standoff period to be sure the heart doesn't spontaneously resume beating on its own. But if you go to the next slide, this is where the tricky part is. Everybody knows people are routinely resuscitated after just 2 to 5 minutes of pulselessness. And so if you could still be resuscitated, you were never dead. I mean, doctors, we're not resurrectionists. When we go in to do CPR, we're not pulling you back from the great beyond. We can only bring you back if there's still life in your body. So at 2 to 5 minutes of pulselessness, you are not yet dead because you still could be resuscitated. If you go to the next slide, Dr. Ari Jaffe is a critical care specialist at the University of Alberta. He has found, looking at the medical literature, people who at 10 minutes of cardiac arrest, who self-resuscitated with no medical intervention whatsoever and made a full recovery. So he wrote a paper saying at this 2 to 10 minutes even after a loss of circulation, these people are not dead. If you go to the next slide, other countries realize this. So donation after circulatory death is actually banned in many European countries because they believe it's unethical to use people during a time frame when they could still be resuscitated as organ donors. And you can see it's Finland, Germany, Bosnia-Herzegovina, Hungary, Lithuania, and Turkey don't allow this.
But not America.
Not America. So if you go to the next slide, the New York Times, I'm always happy to agree with the New York Times. It doesn't happen very often. Wrote a very good article in July of last year. A push for more organs transplants is putting donors at risk. And they told stories of many patients that were taken prematurely. And the saddest one I thought was that of Misty Hawkins. She was a woman with a cognitive disability living at home with her parents. She choked while eating her lunch and had a low oxygen brain injury. At the hospital, the doctors found that she was not brain dead, but they told her parents they did not expect that she would do well long term. And so they offered offered her the chance to become a DCD organ donor. Now, you know, as this was presented, as Mick was saying, to Misty's parents, you know, Misty's parents didn't want their daughter to suffer, and they were told that something good could come out of their tragedy, so they consented to making Misty a DCD organ donor. So Misty was taken to the hospital, and her ventilator was removed. It took her 103 minutes to kind of gasp away her life and become pulseless. And in her state, the doctors observed a 5-minute no-touch period, and then they went right to work, because you have to get those organs as quickly as possible. As we mentioned earlier, without oxygen, those organs very quickly begin to degrade and become unsuitable for transplantation. But when the surgeons sawed with the reciprocating saw through her breastbone, they lo and behold found that her heart had resumed beating, and they saw she was starting to gasp for breath. Well, now what do you do? So what happened is the surgical team left the room, and they found someone else to sew her up. It's not clear, according to the New York Times article, whether she ever received any anesthesia during this period of time. And it took her some 10 or 12 minutes to have her heart stop beating a second time. And her parents were never told. You know, what happens in the OR stays in the OR. Her parents were not informed about what happened to their daughter. The OPO coordinator called Misty's mom and said, gee, we're real sorry. It just didn't work out for Misty to become an organ donor. And it wasn't until a year later, when the reporter from the New York Times contacted the family for comment, that they learned what had happened to their daughter. And, you know, as a mother, I can't even imagine having to live with the knowledge of what my child had gone through, because without proper informed consent, I had allowed it, right? This is just ghastly. And just to finish up with the ghastly, if you didn't think it could get any worse, I'm sorry to tell you, it can. So the next slide shows NRP. This is a variation of what I just described. This is when they want to take the donor's heart, and they want to be sure the heart's in good shape. So what they do is, with this variation, they begin the surgery after that 2 to 5 minute wave off period with clamping the blood flow off to the brain, right? They actually put like clamps over the ascending arteries to the brain to make these people brain dead on purpose. And then they hook up the rest of the body to a cardiac bypass or an ECMO machine, and they resuscitate the remainder of the body. And the heart actually starts beating again in the patient's own chest. That way they can tell if it's healthy enough to be harvested to put into something else. The next slide I'll just look at quickly, just to show you this is happening even in the heartland. This is the protocol for this procedure from the University of Nebraska. And again, it says we are going to ligate, that's tie off the blood vessels to the brain. And they say that's necessary to tie off those blood vessels to the brain so that blood flow to the brain does not occur. Otherwise, you know, you might wake up. Then the fifth step is that once blood flow to the heart is established, the heart will start beating. I mean, how dead are you if your heart is beating again in your own chest? And if you go to the next, you know, this is flying fast and loose in the face of the Uniform Determination of Death Act. I mean, they changed the definition of your death in mid-procedure. First, they say you're dead because your heart is stopped under the irreversible cessation of circulatory and respiratory functions clause. But because they're going to start your heart again, they clamp off the blood flow to your brain. So now you're dead under the second one, the irreversible cessation of all functions of the entire brain, including the brainstem. And if you look on the next one where you were, Gail, the American College of Physicians has weighed in on this again, way back on 2021. The American College of Physicians said the burden of proof regarding the ethical and legal propriety of this practice has not been met, and recommended that this practice be paused. But no pause has occurred. I mean, this is increasing across the USA as we speak. Just to go to the next one, we know that RFK Jr. has started an investigation of our transplant system because they found that hospitals were allowing organ procurement to begin when patients showed signs of life. And you talked earlier about the TJ. If you go to the next one, the TJ Hoover case, the man who was thrashing and moving around. I talked to a whistleblower from this case that was on that OPO team. She said when they came to the debrief, The opioid director shut them down. She said, we did everything right. We did everything by the book. We would do it all the same again. And that's not the attitude that's going to bring us change. So I'm very glad this is being investigated at a federal level. I'm going to go ahead and just tell quickly, if you go ahead 2 slides, Kentucky, where T.J. Hoover lived, has just passed a new law allowing whistleblowers to stop organ harvesting if there are signs of life. And this is very encouraging. Anybody, from the OR staff to the patient's family, can call for a pause. There's supposed to be no retaliation whatsoever against these whistleblowers. And they actually list what the signs of life in the law would include. Now, if you look at this list, the first one is spontaneous movements. Now, as I mentioned, under the American Academy of Neurology brain death guideline, they allow spontaneous movements. But in Kentucky, if you see a spontaneous movement, now you can stop the procedure. If you look down the other ones, vocalization, right? Purposeful movements, observed respiratory effort. Number 5, as an anesthesiologist, is interesting to me. It says changes in heart rate or blood pressure inconsistent with a death declaration. I'm here to tell you, it is routine for organ donors' blood pressure to shoot up when incision is made. At this point, anybody now who hears that beep, 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 beep in the operating room monitor can pause the procedure if they're wanting to. And then this last one, any neurological or physiological signs suggesting pain perception. Again, when you have pain perception, your heart rate increases. And so this Kentucky law does allow people to stop organ harvesting if they see these things. So that's an encouraging sign. So in summary and conclusions, to finish up, the next slide, Gail, shows that heart beating or non-heart beating organ procurement from patients with impaired consciousness is de facto a concealed practice of physician-assisted death and violates both criminal law and the central tenet of medicine not to harm patients. That paper was published years ago by Drs. Heidi, Rady, and McGregor. People have known about this in the academic literature for a long time. The next slide, how can we call a human zygote, a little tiny fertilized ovum who does not even have a brain, a human being, and yet deny humanity to people whose brains just aren't working very well? True. Again, the next one shows a brain death is a prognosis of death. It's not death itself, and it's actually organ procurement. That is the ultimate cause of death for these vulnerable, neurologically disabled people. I'm saying, let's just admit these people are neurologically disabled, and we can make decisions on that basis. It's ethical to remove extraordinary care at the end of life and let grandpa go to heaven. Let's just not pretend that they are somehow dead and then take them for organ procurement to be the cause of their death. The next one, human life continues as long as that body-soul unity continues, even if you're on technology. Being on technology does not make you less than human. And remember the next one, Jahai McMath showed that the brain death diagnostic guidelines are unvalidated, unable to predict irreversibility. Dead people don't get better. All these people who can get better after a properly made brain death diagnosis show this is not death. And this DCD and the NRP donors, they are harvested within the time frame of possible resuscitation. And if you could be resuscitated, you were never dead. And then the next one is the public is being denied truly informed consent. As I mentioned, when you go to the DMV, you don't get any informed consent. And I want to say it's worse than that. It's people are actually withholding the information that any reasonable person would want to know. And this is a violation of basic human rights.
This is never a decision that should be made at the DMV.
No.
Never.
No, it's not fair to those people either. They're put in a position that they shouldn't be put in. I feel bad for the people at the DMV. So
Gail, you already have to wait for hours at the DMV. If we get into all this stuff, you'd have to be there even more hours.
There you go. So if you go to the next slide, I have to tell you, there are more voices being honest about this. This next one is a book written by Drs. Miller and Trug. They write in their book, brain dead donors remain alive, and donors declared dead according to circulatory respiratory criteria are not known to be dead at the time their organs are procured. Now, they want to be honest. These people, however, are not heroes. They still want those organs. So what their solution is let's change medical ethics at the end of life to allow people to consent to euthanasia via organ harvesting. The next slide shows someone with the same idea. This Professor Thaddeus Pope from the School of Law in St. Paul near me. He gave this lecture at Tulane a few years ago. The dead donor rule violations are rampant, and his examples are brain death, DCD, and NRP, exactly what we've been talking about. He too would like people to be able to consent to their death by organ harvesting. And the next slide shows Professor Peter Singer, who's a utilitarian philosopher. He admits, I argue, the evidence now clearly shows that brain death is not equivalent to the death of the human organism. But since he's a utilitarian, he also would say that these people in a coma, their lives are no longer of any value to them or anybody else. So he would like also to be able to cause their death by organ harvesting. Just last December, over at Columbia School of Professional Studies, they had a webinar, Time to Rethink Brain Death, a discussion with experts. And the experts there are the two gentlemen at the bottom, Dr. Loris Keljan from the University of Iowa, and there's Dr. Robert Trug that I mentioned from the book earlier. And they both admit brain death is a severe form of brain injury, but it is not death. They are both in favor of being honest with the public and allowing people to opt out of being declared dead by neurological criteria. Dr. Keljan is sort of the white hat guy in this otherwise rogues gallery I've shown you. And Dr. Keljan does believe that the dead donor rule is an important safeguard against homicide and would like to protect people with neurologic injury falsely declared to be somehow dead from becoming organ donors. Whereas Dr. Trug there, he's the one that would like you to be able to consent to euthanasia via organ harvesting. So our path forward on the next slide, I think we need full transparency for everybody about how death is being declared prior to organ and tissue procurement so as to be able to give a valid informed consent. And, I'm not forgetting people with organ failure. I mean, we have compassion for people with kidney failure and liver failure, but, these people need ethical alternatives. I was speaking a few months ago, and a gentleman came up to me afterwards and says, gee, I've had a heart transplant, and you've given me a lot to think about. And I told him, I'm glad you're here. It's not your fault that you were told that this is what you needed to do next, and you weren't given all the facts. He said, yeah, I understand that. But, he went on to tell me he felt like his conscience had been violated by taking an organ from someone he knows now was killed by its removal. So we need to help everybody. I mean, everyone's been involved with this somehow. I feel terrible for people who, out of the goodness of their heart have given a beloved family member to become an organ donor without these facts, and now finding out later that their trust was violated as well. The last thing, I think Matt brought up a little something about this earlier, a brain death diagnosis, and I think Jenny quite rightly called it a self-fulfilling prophecy, and it is, because in almost every state, if you're declared brain dead, you are not given the option of continuing care. Your plug will be pulled. I mean, there's only New Jersey has a religious opt-out. California, Illinois, and New York have what's called a reasonable accommodation, which basically means you're going to have, 48 hours or so for your family to gather. You really have to get a court order if you want to stop this process and try to get transferred to another facility. There's a case going on right now in Long Island, a young man who is being thought he's brain dead. I mean, the family had to get legal representation to be able to stop that process to see if he could be transferred and given further care because the hospital is ready to pull the plug. So what you're showing next now, Gail, is our refuse to be an organ donor card. Right now, I would tell everyone this is not a good time to be a registered organ donor. And beyond that, the Uniform Anatomical Gift Act was revised in 2006 to be stating that now you have to actually register a refusal so as not to become an organ donor. And the way that happens is this: if I go into the hospital and I'm unconscious, I can't communicate, and my family can't be found within what's called a reasonable period of time, which is again undefined, if I don't have a specific refusal documented that I don't want to be an organ donor, the hospital administrator is empowered to donate my organs or my body on my behalf. And this is why we have to have a actual refusal. So I tell people, if you don't want to donate, you need to go to your Department of Motor Vehicles and you need to withdraw your name. If you have lived in another state and you think you registered in another state, it would be wise to get that off as well. There was just a case, a young man named Keone Peoples had a motorcycle accident. He had not put it on his driver's license in the state he was currently living in. It was not on his military ID, but the organ procurement people found that years ago he had been registered in Michigan, and they used that information to convince a sort of the weakest family member, I guess I would say, to make him an organ donor. And so if you think you've registered in another state, it would be wise to withdraw that. Thirdly, you should withdraw from the National Organ Donor Registry. And I have that on my website. There's a link to that. But if you're sure you've never registered, do not go on the National Donor Registry just to check. Okay, I did this out of pure naivete. People are always asking me how this process works. So I thought, well, I know I'm not a donor, but I'll just go on the National Registry and check. I'm such a dumb buddy. Well, of course, I put in my information and boom, I get an automatically generated email. Thank you for registering as an organ donor. And I'm like, yikes, that's not what I want. So then I had to find the page to unregister. But when you unregister, they don't send you any confirmation. So then I had to find the email, and I had to email and I said, I want confirmation. And then they had to have all kinds of my personal information. And finally, it took a few days, but they did send me the confirmation and a screenshot that I was withdrawn. So again, don't go on just to check, right? It's like the Hotel California. You can check out anytime you like, but you can never leave. So only do this if you think you are an organ donor on the list. And then you have to do the steps to document a refusal. And that's why we have the I refuse to be an organ donor card from our friends at the Healthcare Advocacy and Leadership Organization, the Halo Voice people. Put it in your healthcare power of attorney document that you are not an organ donor. Have your clinician, next time you're at the clinic, put it in your electronic medical record that you refuse to be an organ donor. Those usually follow you anywhere. And tell your family and your healthcare surrogates what your wishes are, so it's well documented. Now, if you go to the next slide, guess what? I'm not against all organ donation. I am absolutely in favor if you would like to be a living donor. A living donor is someone who remains alive after the procedure. Both donor and recipient remain alive. These are two nurses at a healthcare facility in Atlanta. Each had a husband who needed a kidney transplant. Neither wife could donate to her husband, but they found out that they could donate to the other gal's husband. And so they each donated a kidney to the other gal's husband.
That's sweet.
Isn't
I mean, that is good. Right.
Yeah.
So they donated to, that's interesting.
Yeah. And
That's a God thing.
It is. You really, other than the heart, you can donate almost any organ. You can do a kidney, you can do a lobe of a liver, you can do lobes of lungs. They take a lobe from each of two donors to do lung transplants from a living donation. I mean, the heart, the good thing about that is there's a fully implantable artificial heart in clinical trials right now. So, I mean, there are good things on the horizon. So I don't want to end on a down note, but honestly, I've given you so much to think about. So if you go to the last slide there, please look at the website if you want to sort of go over these things again. My book is The Brain Death Fallacy, which is fully referenced. If you're a doctor or a nurse, you'll find everything that you want to know there. And then on my YouTube channel, we have short videos, 5 to 10 minute videos about the things I've talked about that are easy to share with your family.
Dr. Heidi, does the if you have the card from Halo Voice inserted into your medical records, does that mean you can't be a living donor?
No. So the card is not going to go into your medical record. The card, I have one here, you just fold it over your driver's license so that when the EMS picks you up, they kind of know, what track you're on. But yes, you can be a living donor with all of this. There's no problem being a living voluntary donor with all of this. Just that they can't take your organs without your consent.
Yeah, we everybody in our family has one of those.
Mm-hmm.
Okay.
Hope that wasn't too confusing, Gail.
No, that's fine.
So
one
I
of the
wonder,
questions
Dr.
was-
Heidi, have you ever, I'm sorry, have you ever known a death certificate to actually say death by organ harvesting? I mean, they're going to say death, brain death, or they're going to say something else, but they're not going to heart failure, or I don't know what they're going to say. Respiratory
COVID.
failure. They're not going to say
COVID.
organ harvesting on the death certificate.
No, they should.
Oh, I
That
can't
is
imagine.
the actual cause of death, but they're going to put the inciting incident, just like they do for euthanasia. They don't put euthanasia as your cause of death.
No,
and
and
who has,
And like
whatever.
Marsha said, they put COVID for everything now.
yeah. So, and for, hospice patients, they put in there they died from congestive heart failure or COPD. Yeah. They died from a drug overdose, right. Starvation and dehydration. So somebody had asked a question about who does the organ belong to? And in page 418 in my book, because I wrote a lot of information in there that Dr. Klessig has gone over, she and Dr. Paul Byrne, but there was a 2020 Milliman report. Have you seen that, Heidi?
Yes, and now they've updated it in 2025. There's a new one you can see on my website.
Okay. Yeah, when I wrote my book, it wasn't, this was the most one, but it estimates how much each of the organs cost and how much it costs them to remove it. And then it has to be transported, to another hospital. But one of the things that I wanted to mention, and this is not in the United States, but in China, the Uyghurs and the Gons, I believe it is, they have 1.5 million people that are in China prisons, and they are picked up and they are used for organ harvesting. And it is a huge industry, and people from all over other countries will go there, and they actually will put in what kind of organ do they want. And the prisoners are taken aside, and they have different wristbands on, and they know what their blood type is, all of the information, their health information, and they disappear in the middle of the night, and their cellmates are told that, they went on a work mission or something, and they harvest their organs. So it's body parts for money. It's sick.
That's absolutely, you're absolutely right about that. And it's a travesty that, the Chinese Communist Party is being allowed to use prisoners of conscience as a money-making supply of organs from transplant tourists who come all over the world. Now, we should be aware, though, this is not just something that happens on the other side of the globe. I was just talking to Allie Hopper and Jared Sadelsky of Guard Against Trafficking. They're telling me this is happening in Mexico.
Yeah.
In Mexico, Americans are being told, come to Mexico. It's quicker here. There's less paperwork. And so Americans will go. And what Americans aren't realizing is that the cartels are snatching street children and getting the organs that way. She said that there was a 12-year-old boy that from a prisoner she was interviewing that they took out his eye, and it's not at all clear that he survived that. And they actually gave that eye, they flew it across the border into America. The cartels say it's easier to fly an organ into the US than to smuggle cocaine.
Yeah.
Correct.
Oh, yeah.
I've heard about that too. And, just even finding the bodies with organs missing in different fields or tunnels.
I'll never
the amount of
They've had babies that they died, and it went to the ME, the funeral home, and then the parent had twins, and one of the twins died, supposedly. And when it got to the funeral home, it didn't have some of its organs. And the funeral home director is the one that told the family that. And they had no clue. And I don't even believe that baby died. I think they took that baby, and stole its organs and just told the family that one of the children didn't live.
Marsha, who did that?
Pardon?
Who did that? Who exactly did that to that baby?
I don't recall. It was in a hospital.
Oh,
I
okay.
don't, I don't know.
I thought it might have been an OPO or something.
I mean, we talked about people, babies that are bred that are never even given a birth certificate. You never even knew they existed, that are bred for all sorts of things, including the big business of organs. You're right. People need to think about just the ethics of it. Be a living donor, not a dead donor.
I just heard recently, and Heidi, you might know this, that I was just reading something that said that they are actually taking women's placentas. You talked earlier about, being used for cosmetics. And so now this one particular place was telling them to, I'm sorry, I had a moth. They were telling them to take their placenta with them.
Yeah, it's really crazy. I remember when I was a teenager, there for a while there was actually a shampoo they were advertising now with placenta, and I'm like, wow, that's disgusting.
Yeah.
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 Wow.
But there are
That was
some-
actually a thing for some of the weight loss products too, back in the day, that, they were like, oh yeah, it's injected with, placental hormones, and you're like, what?
Yeah.
Our generation started this sick stuff.
I mean, nowadays we're talking about vaccines injected with
All
dead
sorts
baby
baby.
cells.
Yeah, exactly. I mean, there's a lot of ethics involved in all of this. This was a great discussion. It really, really was a great discussion. I would suspect that, the movement that we've seen with regard to legislation in this space was the result of a lot of survivors coming forward to speak up, and it no longer was just like one or two or three, and then whistleblowers coming forward, and that's how you got the legislation in Kentucky that's passed. I'm sure whistleblowers had a big part in that, and I like to we at betrayalprojectusa.org. That is one of the things that we fully believe that is going to move the needle, and I just want to pull in. That's why we need people to. Oh, that is our hospital deadly playbook. But that is one of the reasons why we would like for you, if you had a loved one who was a victim of medical crime, any type of medical crime, whether it was in a hospital, or the COVID protocols, or hospice, nursing homes, shots, or through some type of institutional harm, medical and institutional harm. We want you to put your loved one's information on this wall, because these are all real people. Behind these faces are stories. And Ron Owens, in our kickoff this week, in our memorial, had said something pretty profound, and that is, for every one of these victims of medical crime, there are 7 to 10 co-victims that are impacted. Here's Marsha's mother. So these are the faces behind the medical crimes. And if your loved one was a victim, just put their name, state, date of death, your contact details in case we can't use your photo, and put your photo in. Just attach a photo and submit it. It's really that simple. And we do have people that are coming to share their story. if you want to sit down for an interview, we've actually in the last week had 35 people submit their intake to tell their story, to get on the podcast and tell their story. And so you will see, you can go and you can look at how some of these stories are done. Marsha can attest. She's done her story. Here's my story. Teresa Chikowitz, her father's story here. She's our vice president. Marsha did her story here, and we did the interview. Here's Marsha's mom's story. So many, Matthew Edmonds. This is a great. So Marsha can attest to one of the things that we do in these stories is we honor your loved one. It's not just about what happened. It's not just about the terrible thing that happened. We want their name and their legacy to be remembered. These people were wonderful people with talents, love for family. And so we want the world to understand what was taken by medical crimes. And so we believe that if enough people come forward, that we too will see these crimes be recognized, because we do believe that justice does not begin in a courtroom. It begins with recognition. And once the world understands, or at least America understands, that these were crimes and they can feel it, they feel the human impact of this, that they will demand, they'll cry out for justice. We're never giving up, because our organization is run by victims, by families who had somebody die, be killed by is a victim of medical crimes, or myself as president, as a survivor. And I know what it was like to be in that room. And I know when families come to me, and we have heard from thousands, when they come to us, they know we'll believe them, because I lived it. I know when they come to me and they say they think their husband, their mother, their father was killed in a hospital, I believe them, because I know what was in store for me had my husband not rescued me. And so I want to remind everybody to go there and do that, because recognition is where we're going to get justice. Also, I want people to go to our website and sign the proclamation. I'll show you where that is on our website, actually, so you know. So when you go to get involved and take action, all of our anything we want you to take action on is here. So you can sign the proclamation here now, right at our website, or you can use the QR code. But you just sign it. We also want people to, we've got the Essentials Caregiver Act and the Medical Liberty Pledge that's out there as well, that we want people to take action. But sign the proclamation. The proclamation is basically telling, it's basically we are asking that medical victims of medical crime be acknowledged as a crime victim group, right? So we are the largest crime victim group in America when you put us all together, and we are the only ones that are not formally acknowledged, and we are going to change that. And there's legislators that are passionate about it too, that we just need to show them there's enough support for it. And
Gail,
yes.
I was just going to say, you talk about where you're the largest medical crime victim group in the country, and it occurred to me how, and Mick will appreciate this, that medical errors are the third leading cause of death in the country. Well, how many of those medical errors involve crimes?
Well, that's what we're saying, is because they're not medical errors. I'm saying they're not medical errors. That an error is, I did something that was an accident. That those aren't criminal. There are medical errors. I'm not saying there aren't medical errors. People make I mean, human beings take care of human beings and medical errors, but an error is not a crime. You know, if I accidentally trip you, that's not assault. If I pushed you down, that's assault. There's it's different, and so that's where we need people to be very diligent in understanding the difference. You know, somebody who made a mistake, not the same. You know, I there were nurses in my own case, or that they weren't criminal. They just maybe they were naive. You know what I mean? And then there were others who were actually did commit crimes.
Right.
So, and then there were good ones. There were good ones that tried to help me. You know, there was that a nurse that came in, just like Jenny had, where she was like, "You have to breathe." There was a nurse that came in and he said, "You're gonna make it." You're gonna make it. You're gonna make it. Like he every 15 minutes he checked on me and gave me hope. Every 15 minutes, and he did the things that good nurses do. And I believe some of the things that he did helped save my life. And so there are good nurses, and we know a lot of them, right? So there's three classes of people, but where there are crimes, the fraud and the medical battery and stuff, those need to be reported, not just for the sake of getting justice, but they also need to be reported because the good doctors and nurses that are out there, they suffer because of the bad doctors and I mean, like everything is it affects them. It affects them, and so it's important to do that. And so all
Right.
of these videos will be made available. Somebody in the comments said, "Is this presentation going to be available to listen to again?" Yes, you can replay the live stream. Um, and then I also post the recording. It's going to take me a day or two, guys, because I'm tired. We got a busy week, but I'm going to try to get it out there as soon as I can. On Rumble, BitChute, YouTube, as long as they allow it. Some things when it goes through, they don't let us post it, but as long as YouTube allows it, it'll be on YouTube. But you can replay it and share it on X, Facebook, and Mick Rosato's Rumble Intentional with Mick is it's live streaming there now. So yeah, you can, and we're gonna put all of this stuff on our resources website, and of course halovoice.org and Respect for Human Life. Those are all in our recommended websites. A link to Dr. Klessig's book and Marcia Joyner's books. Those are in our recommended books. So you can always link out if you can't remember what they're called. They'll be in our recommended books. And then join us as well for the rest of the week. We have on Friday, tomorrow, Vax Murder with Road Warriors, Julie Threet and Ron Owens. Their episode is going to be as much of a surprise to me as all of you all, because I don't know who their special guests are yet. So we will see. But Julie and Ron know a lot of people in that space, so it's all going to be all them talking about you know, bioweapons and how everyone is a victim, how to get justice, what what your role is versus the government's. They're also going to be talking about whistleblowers, because Julie is a whistleblower as well, and she's going to be talking about what whistleblowers need to do, and teach them how to blow the whistle, because we need whistleblowers. If whistleblowers don't come forward on any of these things until after something's done, well, they're just jumping on the bandwagon. They're not really a whistleblower. And so they're going to talk about how to report, preparing, and submitting, things like that. So it's going to be 2 hours of pure education. And then on Saturday night, we are going to be talking about Saturday is going to be Survivor Saturday and Second Chances. And we're going to be talking about what it means to have survived, survivors from everywhere, from all different types. If you can join us, that would be great, Jenny. But survivors and what it means to survive, what it means to have a second chance, what we should do with that second chance. Not here's a hint, not go home and sit down, right? Alone to that fence you're sitting on. So
Not sleep, not get a night's sleep.
not right, not yeah. I'll sleep when I'm dead. But making the most of those second chances, right? And we're also going to talk about why it's still happening. A lot of people are like, oh, well, the incentive stopped. Why is it still happening? How do we make hospitals safe again? That type of thing. And we're going to talk a little bit about that. And we're going to talk about how to advocate. Laura Bartlett's going to come on again and talk about that. And we're going to talk about, too, like what's beyond the mission for the what's beyond this week for our advocacy network. And then on Sunday, it's not on here, but on Sunday, we are going to have a closing ceremonies. We are going to read the names again of the victims. And I know that people asked for that again, and they want that. And we are going to do that no matter how. I hope we're there for hours reading names. I hope we have hundreds and hundreds and hundreds of names. And so
Wasn't it Julie who suggested that?
Julie, yeah, she committed to it while we were.
Yeah.
She
To her credit.
yeah. Thanks, Julie. But she committed to it live, and we're happy to do that. All right. So I want to go to Jenny and give her some final words. You let her have some final words, and then Dr. Klessig, and then we're going to close out with a little video. Go ahead, Jenny.
All right. I know that everything that happens in our lives, we can look for the good in it. And that's what I encourage people to do. Yes, take action. Be willing to stand firm on your convictions. Be willing to suffer persecution for them, because you will. You will suffer persecution. We need to be prepared for anything that comes. And the only way to do that is to know what you believe and to be willing to stand firm when things get tough. So I have had a very blessed life. I've had a very blessed life. It was over 40 years ago when that happened, and I was a young woman with small children at home, and I ended up going back to college and changing my field completely because of this. But God has been good to me, and I've had many, many miracles in my life, and I've seen miracles, and I believe that nothing happens without God's knowledge. And if we simply trust, He will draw something good from it.
Amen. I agree with that.
Amen.
Wholeheartedly. He wastes nothing.
Mm-hmm.
I would like to say that Jenny's story is in chapter 5 in the book. And Jenny, I would like for you, if you don't mind, coming on and telling your story in the Betrayal Project. And because they do a wonderful job. So I think that would be good if you would be in agreement to do that.
That's fine. Yeah. Just that's Gail's project, right?
Yeah.
Yes,
That's
the Betrayal Project. Yes.
Yeah.
Project,
So
yes.
Gail, feel free to call me.
Yeah. Marsha, you want to make that happen and organize that, and then you can come on too. And
Yeah. Give her my info.
Okay.
we'll make
I'll
that
get with you and we'll go through that.
That's awesome. Thank you. Dr. Klessig, any closing?
Yes, thank you so much for your words, Jenny. That you inspire me. You inspire me to go on and work even harder to open more eyes and help more people. I mean, really, this conspiracy has been flying under the radar long enough. We need to open up full transparency for people. People deserve to know how their deaths are being declared and how these are not in ways that promote life. So I would just ask, please share the information. Share the information from my website, respectforhumanlife.com. Share my books, The Brain Death Fallacy, and the book that I wrote with a nurse named Chris Bogosh. Before that, Harvesting Organs and Cherishing Life, What Christians Need to Know About Organ Harvesting and Procurement. Share my YouTube videos. You know, the more we share, the more impact we're going to have and help people. I'll have to tell you, a transplant surgeon saw one of my YouTube videos around Christmas, and he contacted me absolutely heartbroken because he was convicted in his spirit that what he has been doing is wrong. And he's actually the second transplant surgeon I know that has come to this realization. So I was able to link the two of them up. And now the first transplant surgeon who's left transplant and now practices general surgery is helping that man. We need to have compassion for all who are involved so that we can do the right thing. So please share the information.
And we have to remember, you used a word there. You said he felt convicted. And when it's from God, there's conviction. When it's from the devil, there's condemnation.
Yeah, right, exactly.
And so conviction can bring repentance and forgiveness and renewal.
Amen.
Absolutely.
That's right.
Amen.
Yep. All right. Such was the case with Peter and Judas. Peter was repentant, and Judas went and hung himself.
Conviction hurts. I mean, we weep, we grieve.
Yeah.
Conviction is painful.
Yeah, it is. It's a good pain, though. It's a
but it leads to new life.
Yeah,
that's right.
Agreed.
And contrition. All right. Well, this has been great. I can't thank you both enough for coming on and sharing all of that information. I know it was a lot of information, y'all, but I will get this out there as soon as I can so that you can digest it and, and continue to share it so people can watch the restream. If people missed it, it doesn't mean that they missed it. You can still rewatch it, right? So thank you very much, and I'm just gonna close with this little short video of some of the faces that we're talking about this week.